Hi, my name is Dr. Louisa and I make child health education videos. How do we manage when we see a child who comes in with toe walking? The first thing is to take a good history, that is to find out information about the background of the individual, what happened during the pregnancy, delivery, and in the early period after that individual was born. And this is to look for clues of anything that may have resulted in muscle tightness in the lower limbs. In addition to that, we also examine for tightness in the Achilles tendon and the calf muscles, just so that we see if there's enough flexibility in that area. Sometimes we may work with another professional who may also assess sensory profile in the individual if this is indicated. We also want to do a developmental history in order to determine if there's something that is developmentally relevant in the individual, such as clues towards a diagnosis like cerebral palsy or autism spectrum disorder. The management of toe walking is going to depend on what we think the cause of toe walking is. So if there is tightness in the calf muscles and tendons, then we would work with a physiotherapist, for example, in order to stretch those muscles, as well as use appropriate devices that we call foot orthoses to keep the foot in a neutral position when they are wearing shoes. Another thing that we may do is to work with an orthopedic specialist or a rehabilitation specialist who is trained in the use of Botox to use Botox in the calf muscles and allow relaxation of the muscles so that the foot can be placed in its neutral position. In the context of another issue such as a sensory processing disorder or autism spectrum disorder, getting to the root cause of the problem is essential in order to manage the toe walking.